Okay. Welcome, everyone. I am Megan Mitchell, and I am excited today to bring you a clinical conversation for our continuing education platform. And today I am here with Maeve McMahon. She is also with us at Agents of Change. She is our community manager, and we're just going to have a discussion about school avoidance, school refusal, and truancy. So today we are talking about a topic we see a lot in our clinical practice. So we will be talking about from home to homeroom, facing the challenges of school avoidance, school refusal, and truancy. So I'm not going to read you my bio, but a little bit about me is I am a psychotherapist with children and adolescents, and Maeve is a pediatric behavior health clinician. So we thought this was a really important topic because we are seeing school avoidance, school refusal, and truancy a lot in our practice. And a lot of times parents don't know what to do, clinicians might not know what to do, and the school might not know what to do. So we are going to have a conversation about how we can support our clients who might be having or experiencing any of these behaviors. Okay, what will be our learning objectives for today? So after this, you will be able to identify the psychological, social, and academic factors contributing to school avoidance, school refusal, and truancy. You will be able to define school avoidance, school refusal, and truancy. And then you should be able to generate 3 to 5 strategies to help students experiencing school avoidance, refusal, and truancy transition back into the school setting, because we do want you to leave with some tangible strategies and resources that will help you in your practice if you do have some school avoidance, school refusal, or truancy cases. And then, why is this topic important? It's important because you might see it in your practice. If you work with young people that are of school age, you will most likely have a case of some sort of school avoidance or school refusal. The severity may differ. And those students or young people that are exhibiting some of these behaviors often have challenges. They might have academic challenges because they fall behind. They might have social challenges because they might have missed those social opportunities with their peers, and they might have emotional setbacks. They might experience shame or embarrassment when they do try to transition back into school, and this can affect their well-being in school and outside of school. And school refusal usually is a symptom of something more going on. There's usually anxiety or depression or bullying or a learning difference. Something's usually going on that more people need to be involved, right? Most kids don't, I mean, yes, we sometimes say, I don't want to go to school, right? That there's a normal spectrum of what would be appropriate. And then there's those that really have such severe symptoms they cannot get to school. And why else is this important? Because as professionals, we want to make sure that we are having a comprehensive and collaborative approach. So Maeve and I, we work very closely with a team of people. It's going to be working with the parents, working with the student. You definitely need to tap in the school. You got to figure out the best way to do a wraparound approach with the student to ensure that everyone's on the same page, and that's at home, school, and in the therapy setting. So let's go ahead and jump in. So Maeve, let's kick it off with this saying. What do you see in your practice? Who do you see? What is the ages? And are you seeing school avoidance, school refusal, and truancy with your caseload?
Yes, so I'm a pediatric behavioral health therapist. So the kids I typically see in my practice are between 12 and 18. So I would say they're middle school to high school, mostly high school. And there's definitely a lot of school refusal, especially recently, I think with the transitioning back into in-person school. There's been a lot of avoidance and struggling just to get the kid to school. So I've definitely been seeing it more frequently. I will say I personally have been seeing it more with my female patients as well. And typically they do have a diagnosis, I would say, most often of either anxiety or depression, but there's definitely other things that can play a factor as well.
Yeah, I actually am seeing it a lot with middle schoolers. I would say mostly just in my practice. And it has been challenging since the return from COVID. I think this population experienced a lot of that turmoil of in and out of school during really important years. This
Hmm.
is like their later elementary into middle school. So they really are struggling to adapt to school. And I would say last year and this year were really the first school years that were the most like quote unquote normal, where they were
Hmm.
actually back for the entire school year.
Hmm.
So yes, I'm seeing that too. And it's no surprise here. This was a study done in 2022. So COVID was already a mist, but school refusal behavior affects between 1 and 15% of youth. So if you work with youth, everyone out there, you will probably see a case of school refusal behavior. And that's what it's referred to in the literature, SRB, school refusal behavior. But we're going to talk a little bit about what the differences are, because there's different levels. It's not that everyone's going to have the same severity of school refusal behavior. So there's school avoidance. And this is kind of a broad thing. And it's exactly what it sounds like. These are students, kiddos, young people that are avoiding going to school or avoiding staying all day. I see that too. They might go half day and then they have a stomach ache. Oh, please come and get me, mom. Or I can't, I need to come home early. I need to go to school late. Those variety of things. So that can be tardiness, truancy, and school refusal. There's something that they're avoiding. So that's kind of the big bucket thing. That's school avoidance. Do you see different severities with your patients too, Maeve?
Yes, definitely. There's definitely the kids who just struggle to get there for like first and second period, and they are like failing just that first and second period, but then once they get to school they're fine. There's the kids who will get to school and call mom at lunchtime and be like, I need to be picked up. And then there's the kids who just will not show up, and that's typically when the truancy comes in.
Yeah.
And it actually becomes I mean, it's all a significant issue, but it becomes more of a known issue, especially with like the parents getting involved.
Yeah. So school avoidance is like we said, kind of that big umbrella, and then there's school refusal. And there's actually a difference. School refusal is like level 2, and then truancy is level 3, we'll call it.
Hmm.
School refusals when they're distressed, their anxiety, their fear, like the thought of going to school, they are refusing to go. So these are our kiddos, like parents might be calling you as a clinician and saying, what do I do? I'm not going to drag my 15-year-old into the car, and that's ridiculous. They might actually have physical somatic symptoms. They're feeling nauseous. They might be shaking. Our younger ones might be tantruming, right? Having these big meltdowns because their nervous system is so activated at the thought of going to school that it's causing them to go into crisis mode, is what I say with parents. I say they are completely in crisis right now.
Hmm.
And usually there's different underlying issues. Like you mentioned, there might be separation anxiety. So it's really hard to leave mom or dad or caretaker. Generalized anxiety, just worries about everything. Well, I have a test second period, so I can't go and I didn't study enough. I see that a lot with some of my kiddos that are very high performers, actually. They fear that they'll perform poorly, so they'd rather just not go to school at all. Social phobia, if it's really hard for them to engage in group work. I have some kiddos like that. It's I don't want to go because I'm avoiding this person that I maybe have conflict with. And then depression, right? It can actually be very difficult to get up in the morning to find that energy to go. So that's school refusal. But usually with school refusal, parents know, right? That parents want them to be in school, but parents are also kind of stuck as well. Truancy is when it gets a little bit more tricky because this might be some of our older kiddos where they're having unexcused absences. The parents might not, they might, get to the building, parents drive away, or they take the bus or something, and they're not going into the school building. So the parents would not even know this is going on until they get a call from the school saying, where's your kid been all week? And they're like, what do you mean, where's my kid been? Also, sometimes parents go to school before the kids, and the kids are expected to get to school on their own, and so they don't show up. And truancy can be because of an underlying issue, but it also can be from other issues too, right? It could be peer pressure. if they're truant, right? Maybe a bunch of them are skipping class. I hope you enjoyed this social work CEU preview from Agents of Change. If you're looking to complete this CEU or for more great continuing education content, please visit www.agentsofchangetraining.com. With Agents of Change Training, you get unlimited access to 150 plus ASWB approved continuing education courses. For one low annual fee, we also have 5 free CEU credits available too. Check it out at www.agentsofchangetraining.com.